Welcome back to Hiss and Tell. In today's episode, I'm joined by veterinarian Dr. Kevin Toman, and we're going to talk all about helping cats not just live longer, but live better. We dive into feline longevity, early signs of chronic disease, HCM, nutrition myths, dental health, supplements, and everyday changes that we as cat guardians can make to support healthier, happier lives. Our conversation is about prevention, quality of life, and what truly matters as our cats age. I think you'll learn a lot from this episode, and if you enjoy it, please take a moment to rate and review the podcast. It helps more cat guardians find us. All right, let's go. Welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me today is Dr. Kevin. He has been a vet for 40 years, and he currently specializes in pet longevity science. Welcome, Kevin.
Well, thank you very much, Christina. I've listened to a couple of your episodes, and I really appreciate what you're doing for all us cat lovers out there.
I'm so glad to hear that. So can you tell me a little bit about who you are, the space that you work in, what it is that you're up to?
Sure. I have been a veterinarian since the dark old ages of 1986 when I graduated from UC Davis. And so over that 40-year career, I spent much of my time in California and Colorado, generally in small animal practices, sometimes in the more rural areas of those states.
Mm-hmm.
And as part of that, I was the de facto emergency vet. And so I saw a lot of kitties ranging from everything from hit by car to cat abscesses to the dental disease, by golly, on a daily basis. But about 10 years or so ago, I began specializing in pet longevity. And so I currently operate a telemedicine consulting business called
Mm-hmm.
www.helpingpetslivelonger.com. And the tools that I have at my disposal are concierge consults via telemedicine for your clients. I offer a list of supplements that are proven by 40 years of veterinary practice and prescription longevity drugs like rapamycin, acarbose, and our friend Felicin to treat hypertrophic cardiomyopathy in the kitties we love.
All right, cool. So for you, what do you think living longer actually means for a cat? And how do we make sure that living longer also means living well?
That's the key. You hit the nail right on the head in your first couple minutes of this podcast. The honest truth, Christina, is you and I should care less about how about lifespan and
Mm-hmm.
more about quality of life.
Right.
Now, if we can combine them both, that's even better. And the analogy that I always use is unfortunately that of my own mother, who was a smoker for all of her life and so ran into all the smoking disease issues,
Mm-hmm.
including lung cancer. And she spent the last 2 years of her life laying in bed. She was bedridden because that lung cancer had spread to her hip. And
Mm,
I would submit to you that that extra 2 years of life offered my mother no benefit because she
yeah.
was not enjoying her life. She had no quality of life. And so if you and I can extrapolate from that lesson into the care of the kittens and cats that we love, they'll be a lot better off for it.
Yeah. I agree. I think for most of us who are watching parents or grandparents who are elderly or going through serious health issues, I think we probably confronted similar things and it is difficult.
Cats'
Yeah.
lives are much compressed, and so, on the one hand, we can love them with all our hearts while they're with us, but on the other hand, we know that instead of the 77, 78 years that my mother lived, I mean, you and I have to get all our love, and we have to wedge that into, 14 or 16 or 18 years of life.
Yeah, it's true. So if you look at cats today versus 40 years ago when you started practicing, what are we doing today that's good? And then what are we still kind of missing?
Well, I think that the veterinary medicine has improved. I think veterinarians like me are probably a little bit smarter now than we were back in the day about the diseases and how best to treat them. I
Mm-hmm.
think that I'm gonna argue both ways in terms of cat diets, and we can talk more about that. But really just the understanding of, I think, perhaps the biggest advantage to cats these days is just we have a better understanding of their mental and their emotional needs,
Yeah.
centered around when to keep them inside and how best to offer them the stimulation and the happiness that every cat should have. And so I'm going to backtrack to the statement I made about diet because you and I can talk about the ways that diets have improved over the years. And then I can argue in the very same breath that all the time you and I see the cat diets with cream on the top and gravy and everything that's designed to sell you and me. One of the most common health issues that I see in the cat population is obesity. And so, therefore, I see a higher incidence of diabetes, I see a higher incidence of cancer, and I see a
Hmm.
higher incidence of arthritic pain.
Yeah. Yeah. That absolutely makes sense. And I think you really hit on something that I think a lot of people may not realize is that the marketing about cat food is so clearly skewed towards humans and it absolutely has no bearing on what is really good for cats or what cats might actually enjoy. It's just crazy that it's so heavily, I mean, obviously we're the ones spending the money, but it's really so heavily marketed towards what would be palatable or enjoyable looking for people, which is we're not the
100%
ones.
correct.
Yeah, we're not the ones
100% correct.
enjoying it, except for I think I've seen a few crazy clips on TikTok of people who eat cat food, but, good luck to them in their endeavors, that's not
There you
most of
go.
us.
Atta girl.
Yeah. So you mentioned relationship-driven care. What does that actually look like for people at home?
Well, I'm going to lead with something that's hard for me to say, Christina,
Mhm.
and that is that I believe veterinary medicine, as it's currently being practiced, is broken. And I say that because for many pet parents, every time they go into one veterinary clinic, they're seeing a different doctor. And that's clearly not in
Yeah.
their best interest. It's not in the best interest of their I say that because many veterinarians are employed by corporate businesses these days,
Mhm.
and those corporate businesses enforce a 20-minute maximum office visit. So you don't have time to sit and talk about the pink elephants behind you. You don't have time to sit and learn about Christina and what you guys are doing for fun and games. You're really put in a situation where a new veterinarian spends the first 5 or 10 minutes of a 20-minute office visit trying to figure out exactly what has gone on in your pet's health past, trying to diagnose an immediate disease and offer you an immediate solution. But
Mhm.
the reality, I'm gonna say this categorically. I think that the best medicine, Christina, is relationship based, where I recognize you guys and your kitty when you walk in the door, where I
Right.
can say, "Yeah, I mean, last year we did a dental, so we may not have to worry about that this year." Or remember when we had to sew up your kitty's abscess, or whatever the case may be. So and then we can move forward and look not just at your cat's current health, but also use whatever time it takes, whether it be 20 minutes, an hour, 2 hours, whatever, to look not just at the next month of your cat's health, but trying to develop a plan for the next year or 2 years or 6 years down the road. That
Right.
takes both knowledge and the time to use it. It takes a relationship.
No, I totally agree, and I actually see that in the histories of a lot of my patients in my practice. Some of my intake questions are obviously, "Who's your vet? Who do you normally see at the veterinary practice?" And so many of these practices are owned not only by corporations but by private equity, which then is creating a whole host of other issues and things like you just said, where every time they're going in, they're seeing a different veterinarian and often a very new veterinarian, people who are just coming out of school, who maybe haven't received as much training or they're not being supervised in the way that they maybe should right off the bat. And it can be hard to hear a lot of these stories. But I also am wondering what are the alternatives, especially when you live in, I'll say in our community, there are no more small practices. They have been purchased all by a VCA or a bond or any of these huge corporate vets. So we actually take our cats 2.5, 3 hours back into New York City to see our beloved old vet who's amazing. And she's the best vet I've ever met in my life.
Yeah.
But I think for a lot of people that they can't necessarily do something like that. So how would somebody begin to build a relationship, with a vet when they're caught in this kind of corporate cycle?
Well, and so you have to understand that I have a horse in this race, Christina.
Yeah.
My first answer is, let's talk. If you have a kitty that is, especially if you're starting to run into HCM or kidney disease or chronic
Mhm.
pain, there's value in chatting with somebody like me because I can build that relationship with you. Now, yes, it is over Zoom, it is via email, it is via text or whatever the case may be, but I'm the veterinarian that could offer you that guidance. So now setting that aside, the reality is that It is. It's very hard. And so I would tell you that I think that the very best way to build those relationships within a veterinary practice are to look for, as you suggest, the non-corporate businesses. The veterinarians, the veterinary clinics that are in fact owned by a veterinarian instead of by a large corporate entity of one type or another. The second best would probably be to align yourself with an AHA based clinic, American Animal Hospital
Mm-hmm.
Association, or AAHA, because they conform to some pretty rigorous standards. And
Right.
all the practices that I've had have been AHA practices. It takes a lot of work to maintain that. Amongst that work are specific practices centered around relationship building and
Mm-hmm.
specific practices around record keeping to ensure that the same records are available to each doc. And
Right.
so I do believe that, as you suggest, a true private enterprise veterinary clinic is the best, and AHA practices would be second.
Yeah. That's good advice. This is just for my own curiosity, but when you're working with clients over Zoom during doing telemedicine, how are you getting blood work? How are you doing any of that stuff? Are you sending them then to a private practice veterinarian to do that,
And
or how does that happen?
that's the second great question you posed. So my telemedicine based practice makes it difficult to draw blood. I
Yeah,
can't draw blood from kitties in Connecticut, for instance,
sure. Yeah.
from my home here in California. And so it's interesting that you asked that question because there is a network of house call veterinarians
Hmm.
that is forming, and I am working with them to see what kind of coverage they can give me so that in Connecticut or in Colorado or in North Dakota, maybe there's a house call veterinarian in your area who could draw the lab work that I need to best
Right.
assess your pet. The other approach, however, more commonly at this point, is just simply to enlist your local veterinarian in the game, so
Hmm.
that if your cat needs their kidneys checked or their heart checked or whatever the case may be via a blood test, I specify exactly what blood test you need to run. You go
Right.
ahead and take your kitty into the vet, say, listen, this is the test XYZ that I need. You get the answers from them. You and I share the answers, but here's the difference. Then you and I sit and talk about what those answers mean, in
Right.
not just in terms of your cat's current health, but also over the longer term.
Yep, that makes sense. Makes a lot of sense. So, sort of going back to our earlier discussion, talking about aging and chronic disease, what are the earliest signs of aging and chronic disease in cats that most people might miss?
The hardest part is our cats are so dang stubborn
Yep.
and so used to masking disease or masking pain that
Mm-hmm.
honestly it can be a real pain. It can be very difficult to catch disease early in the game for our cats.
Right.
And so that's why a schmo like me, I mean, dogs are much simpler. I think humans are probably the worst.
Yeah.
If you have a kid or somebody's sensitive and they come in crying or limping, by definition that they have a pain in their foot. And dogs are to a large extent like that as well. But cats
Mm-hmm.
on an evolutionary basis understand that if they show pain, they automatically become prey rather than
Right.
predator. And so there's an evolutionary component to cats not showing disease, not showing discomfort. And so in all candor, Christina, that's where my blood test, my urine test come in handy, because
Mm-hmm.
now we're at a point where with one blood test, I can pretty accurately tell you whether your cat has heart disease without taking x-rays, without doing the echo exams, etc. With the right urine test or the right blood test, I can assess your cat's kidney disease long before you start seeing the weight loss, the poor hair coat, the vomiting that accompanies kidney disease. So it
Mm-hmm.
really becomes a combination of physical examination findings and lab work to act as a true early warning system for the cats we love.
Right. Is there anything that you would recommend people look out for at home? Switching where they're sleeping more, sleeping less, eating less, hiding. I mean, these are kind of examples of maybe more pain than a simple like beginning of chronic disease.
But you're absolutely correct. There's nobody who will know a cat better than that cat's parents.
Right.
So if we can break this down just by virtue of the examples that you used. If you see your cat slowing down, they don't want to jump on the counters
Mhm.
anymore. They don't want to jump on the back of the sofa anymore. Then it's safe to assume that they are running into orthopedic pain.
Right.
If, on the other hand, they've never jumped on the sofa and now all of a sudden they're constantly up there, they're, running circles around the room, then you and I have to think of diseases like thyroid problems,
Mhm.
hyperthyroidism. If all of a sudden they're not eating as well as you and I would like, then the question really becomes, is it an oral problem? Because dental disease is rampant among cats. It's the
Mhm.
single let me be clear about this. Dental disease is probably the single biggest lever that you as a pet parent have to address in helping your cat live their longest life. So if your cat is not eating well, is it because they feel miserable all over, which would make us think about kidney disease or
Right.
whatever, or are they painful in their mouth? And there is no clear, many times there's no clear answer to that.
Right. Yeah, that's true. But because I'm really interested in supplementation for cats, and I know that this is something that's in your wheelhouse, we just started giving Kevin, our cat Kevin, who has FIV, and he had very bad stomatitis that resulted in him having to have his teeth fully out, and that still did not fully relieve the stomatitis. Okay, he's stable, after several years on pred for many years, but his vet recently recommended that he start supplementation of that, like, beef tallow supplement.
So I think, I mean, there's a lot of bullshit out on the human market, out in the veterinary
Absolutely.
market around supplements, and feel free to edit that if you choose.
No.
And so I only carry 15 or 16 supplements, but I can tell you
Mhm.
exactly why I carry them and exactly what pet will benefit from them.
Sure.
But, things like glucosamine and chondroitin, the Dasiquin or Cosequin products that you
Right.
and I use, Christina, for 20 years, have been disproven. Study after study tells us they just simply don't work to help a cat's arthritic joints. Now,
Mhm.
there are supplements that you and I can speak to very directly that have been proven to work for those painful cats. But part of what a pet parent needs to understand is that just because a product is on Chewy, or just because,
Yeah.
unfortunately, even because your veterinarian recommends it, does not necessarily mean that that supplement that you're considering is really good or healthy at all for your cat. And
Mhm.
but there are supplements that are proven to benefit kitties. Simple things like lysine for,
Mhm.
chronic herpes viral infections. If we're talking about arthritic pets, undenatured type 2 collagen or UC, this is
Mhm.
the easiest thing in the world to give to your cats because you don't have to give it as a pill. You can open these little pills and sprinkle the powder over your
Right.
food, and the cat will never look back at this. Fish oil most
Yes.
cats love fish oil, and it has a variety of benefits. And so, although I can't speak to your particular beef tallow product, the reality is I am a supplement kid. And the question is, can you and I find proven supplements that will benefit your cat? And if that's the case, I am 100% in.
Yes. So the supplement that she had us get is called 1-TDC.
Okay.
It's 1-tetradecanol.
Yeah. Yeah, and
I
that's
don't know.
been proven more for dental disease than for mobility.
Yes,
We think
exactly.
yeah, we think that it does help to reduce inflammation, and,
Yeah.
cats being cats, what would work well for one of your 14 or
Yeah.
18, I can't remember.
15.
Okay,
15
alright, so
cats, I know.
so what might work well for Kevin, 1 cat in your
Yes,
family home, may not work well for 3 others, but the reality
exactly.
is that if you and I are using science-based products that are proven safe, there's only one way to know, and that's to
Yeah,
try them. And I'm a
exactly.
firm believer in using natural products where we can, as opposed to prescription drugs like prednisone, for instance.
Same. I'm really trying to back him down because he's been on the prednisolone for so long
Mhm,
that was needed for that acute stomatitis, that now that
mhm.
he seems to be in a recovery period, to back him down and see if this supplement can do
Absolutely.
something to help keep that inflammation down. And he's already on all of our cats over 6, we keep them on a fish oil supplement just because of arthritis, and we want them to, feel nice and loosey goosey. And, like, again, it's not going to hurt anything. So if they're taking some fish oil and it works, great. If it doesn't work, fine. They're just getting some extra, oil in their food.
There you go.
I
So,
did
I
I did
appreciate your knowledge.
think that there was new literature out on L-lysine not being as effective, and maybe that was just for when people are giving it to cats who are having, like, a coronavirus or a calicivirus infection, because I know people do tend to give it for those instances as well, and I guess it came out that it was not effective for
And the
those.
reality is that here's the dilemma that you and I have, Christine. I mean, if your kitty goes in, if you take Kevin the cat in for recurrent conjunctivitis, recurrent red eyes, there are a variety of different things, ranging from allergies to dust,
Mhm.
to a number of different physical problems, and included in that are the viral upper respiratory diseases like
Yeah.
herpes or colici, etc. The hard part is that those viral upper respiratory diseases are pretty difficult to differentiate. Pretty difficult to tell whether you're dealing with herpes or colici
Right.
without spending a lot of money, and sometimes even when you do spend a lot of money. So, the value of lysine is it's been proven against herpes virus, but the reality is that many folks are going to use it anytime they have a cat with red eyes. And the good news is
Yeah.
it's fine. It won't create any problems for them, but we have to understand that by definition it's not going to be as effective as we'd like.
Sure. That makes sense. And it also makes sense that it helps pet parents to feel as though they're doing something.
Absolutely, and that counts. That
Yeah,
counts.
absolutely. Exactly. Exactly. So, are there behavioral changes that are often dismissed by vets that or that you know of, but that are actually like red flags for cats especially?
Well, yeah, I mean, I think that behavioral changes are sometimes the best way for us to assess our cats, to be honest with
Mhm.
you, rather than physical, for all the reasons that we talked about. Now, you and I can separate out vomiting, I suppose, and there are several different reasons for that.
Right.
But by the time you and I see a cat actually limping or actually hiding, usually there have been weeks of buildup to that.
Right.
And so, we talked about the cat who's more reluctant to jump than they used to be, or sometimes in the case of thyroid disease, more active than normal. But these things count, and so the more clues that you can look at in terms of your cat's thirst, in terms of
Mhm.
I mean, again, thirst goes either way. If it's diminished thirst, many times you have to worry about kidney disease. Increased thirst, you worry about diabetes. And so there's really kind of a list, an algorithm that you can look at home to determine whether your cat is healthy or not. But behavioral changes count, whether they be vocalizing, helping
Mhm.
you as you're cooking versus not helping you when you're cooking, drinking water out of the bathroom sink versus not drinking water out of the bathroom sink, eating a full meal versus not eating a full meal. I mean, they're all over the place, but
Yeah.
you have to love your cat. You have to be conscious about them because let me repeat what I told you earlier. In my mind, no veterinarian will ever know your cat as well as a loving cat parent will.
Yeah. It's true. I would add to that list toileting changes because I think
Mhm.
I see a lot in my practice of people coming to me and being like, "Oh, my cat is having house soiling issues, especially pooping on the floor."
Mhm.
And people are saying, "Oh, the cat's spiteful, they're just mad at me. This is the cat, being a jerk." Whereas in reality, I'd say 90% of those cases are medical. If it's
I
if it's a
wouldn't
sudden
argue at
thing,
all.
yeah, and it is really difficult sometimes to convince, clients that this is something that they really need to go see their veterinarian
Yeah.
about, that there's something going on.
No, Christina, you're
Yeah.
100% correct. And I mean, in general, and listen, I don't pretend to have your level of expertise when it comes to behavior. But in general, in my experience, if cats are pissed at you and me, they're going to target your shoes or your underwear drawer or your socks or your
Mhm.
jacket that's laying on the sofa. This is not going to be indiscriminate pooping or peeing where one time they
Yeah.
poop in the kitchen, the next time they poop in the family room, next time they poop in the hall.
Yeah.
If you're seeing those kind of changes, then that A, is it diarrhea? I mean, because sometimes when you gotta go, whether you
Right.
walk on 2 legs or 4. But if it's firm poop, then I start thinking about many times either abdominal pain or
Mhm.
actually, as funny as it sounds, orthopedic pain because
Yes.
it hurts to hunker down and assume the position for some of these cats. So a lot of
Mhm.
times it's easier for them not to be crude about it, but just to squeeze poop out as they're walking rather than hunker
Yeah,
down and assume that defecation posture. The
absolutely.
same thing applies to kitties with urination problems. I mean, if generally if they're pissed at you, you're going to know it because your underwear drawer is going to be the one that pays the price, not your partner in crimes or whatever the case may be. But if
Mhm.
they're peeing all over the place, especially, let me repeat this, especially as a male cat, that can become an emergency
Yes.
very quickly, guys. And so if
Well,
you
especially if they're not peeing.
Yep,
If
and
they're
so if
entering
you
and exiting and not peeing, that's when it's
Atta
really
girl, you took
serious.
the words right out of my
Yeah.
mouth. So if you see, if you see your male cat kinda hunkering and trying to pee and then moving a few steps and hunkering and trying to pee, that is a bona fide 24-hour-a-day emergency, because I have seen cats who were unable to pee by virtue of urinary crystals in their
Mhm.
bladder that pass down into their little male cat urethras, and I've seen them rupture their bladder and die.
Yes.
And so this is nothing. I mean, all of us can sympathize with the pain of an overfull bladder. I've been there. I'll bet you have, Christina, and our
Mhm.
cats just simply don't have the ability to tell us. So you're absolutely right. When it comes to urinary and defecation behavior, simple little things can be a big clue in terms of your kitty's health.
Yeah, and I'm a huge advocate because I'm a dork for data collection and data harvesting, and so especially in a household with this many cats, right? It's very necessary. I always say to people who live in multi-cat households, especially if you have more than 2 to 3 cats, it's great to put motion sensor cameras in front of your litter boxes so that way you can see if your cats, especially male cats, but even female cats, if they're entering and exiting a lot, are they straining, are they vocalizing when they're going to the bathroom? Are they entering and not producing anything? It's not the most fun thing every night to go through and review the footage, but it is very helpful, and then that way, I'm able to really have a handle on the general health and well-being in the house, see what the patterns
That's a
are.
that's a great thought.
It's
Great thought.
really helpful, and especially when I get a behavior case for house soiling, this is the first thing that I tend to ask people to do if they've gotten a clean bill of health from their veterinarian, is to set up a camera system so that we can see exactly what's going on. And it can be very cheap, but it really gives you a lot of data. Not necessarily data
100%.
that people want, but it's data that I think is interesting. So
I
again,
fully agree. I fully agree.
I'm a dork. So, pivoting from bathroom stuff, I know that we talked about HCM. So, for listeners who may not be familiar, can you explain what
What
hypertrophic
HCM
cardiomyopathy in simple terms is, please?
Sure, sure. Well, let's start with the basics there. Hypertrophic just means your muscles getting bigger, like
Mm-hmm.
Christina or me when I'm lifting weights. Hopefully, my biceps get bigger, and that process is called hypertrophy. Now,
Mm-hmm.
cardiomyopathy tells us that the cardio means heart, and the opathy part means that you got a problem.
Mm-hmm.
So, putting it all together, hypertrophic cardiomyopathy is a problem of the heart caused by muscle overgrowth. And the bottom line is that, and this typically affects the left ventricle, which is the primary pumping chamber of the heart, because it's the one that drives blood from your heart into to your kidneys and to your legs and to your brain and every other component of your anatomy other than your
Right.
lungs. And so what happens with hypertrophic cardiomyopathy is that the heart walls get thicker and thicker in that left ventricle, and that prevents it from fully expanding and fully contracting. It doesn't have the flexibility to go ahead and eject as much blood. Now,
Mm-hmm.
this disease affects 1 out of 6 cats worldwide, and if untreated, it will cause their death. So let me be clear about that. You look at your 15 cats in there, and
Mm-hmm.
2.5 of those cats are likely to develop hypertrophic cardiomyopathy over the course of their lives. Now, the good news is we think we can diagnose it pretty early with a simple blood test called
Mm-hmm.
Pro-BNP.
Yep.
And lots of times that will tell us before the disease is ever found by me listening to it with a stethoscope or anything like that.
Mm-hmm.
And here's the most important part about HCM. That is that, I've been in veterinary practice for just over 40 years at this point, and for 38 years of that practice, Christina, if I told you that your cat had HCM, what I was really telling you to do is to go down to your nearest Home Depot and buy a shovel and start digging a hole in your backyard, because for 38 years in veterinary practice, we had no effective way to treat HCM. But about 2 years ago, that changed, and there's a longevity drug, a longevity molecule called rapamycin, which I take as an aside and which I prescribe many times for preventive longevity in dogs. But
Hmm.
this particular molecule called rapamycin has been proven to slow, stop, or occasionally even reverse the changes of HCM and allow our cats to live happily ever after. Now, it doesn't work for every cat, but it works
Right.
about 80% of the time. And that's clearly a lot
That's
better
great.
than my handing you a shovel and telling you to go out and spend some quality time in the backyard.
Absolutely. What age does this usually strike cats, and are there early warning signs? Is it something that is usually kind of silent until it isn't?
Yeah. All of the above,
Okay.
unfortunately, and I'm trying not to make light of it, but, I am dealing with probably 200 HCM cats right now in my practice, and while most of them, Christina, are in that 9, 10, 11, 12, 13-year-old demographic.
Hmm.
I have 1 and 2-year-old cats under treatment as well,
Wow.
and many times these fall into specific breeds, like Sphynx cats, like short hairs that have an actual gene that sets the table for hypertrophic cardiomyopathy. Maine Coons are another breed that gets HCM all the time. And so the younger cats are typically one of these breeds that has a genetic predisposition to this
Hmm.
disease. But we think that pretty much 1 out of 6 cats will develop it just by a virtue of aging. And so you really have some very young cats affected, but you also have a majority of older cats affected.
Maine Coons just kind of have a predisposition to heart issues generally. Like they have congestive heart failure more frequently. And
They
I
do.
had a Maine Coon who had congestive heart failure, but he did great on Lasix for a bajillion years and would even
Yeah.
come every night to be like, "You forgot my pill, dummy," and tell me. Yeah,
Yeah,
but the
so at any
short.
rate, I mean, it's well worth discussing with your veterinarian, and if you're if you have, a Maine Coon or there are a lot of different breeds of cats that have specific health issues, but if you
Right.
have a Maine Coon or a Sphynx or a short hair, I would suggest to you that even as young as 2 or 3 years of age, ask your vet to draw a simple blood test on your kitty. Submit the Pro-BNP, which simply checks for stress in your cat's heart muscle.
Mhm.
It's easy, it's cheaper for you than having x-rays and echo studies done and this and that. It's just a needle poke for your kitty. But if your cat's heart comes back as stressed, if your Pro-BNP comes back as abnormal, then you have to go looking. And I'm happy to help you through my longevity practice, but the reality is you need to find a veterinarian who can walk you through the diagnostics necessary to help you understand whether it's HCM or another disease affecting
Right.
your cat's heart.
Okay. Do stress and environment impact heart disease in cats at all, or is it really all genetic?
No, absolutely. I mean, sometimes, Christina, it's just the shit that happens as we age. Let's
Yeah.
be clear. And so there's no way to prevent that. But it's not rocket science to understand that if you have a multi-cat family and one cat is always stressed, one cat is always getting the snot beat out of him or out
Mhm.
of her, that cat's blood pressure is probably increased on an ongoing basis. And one of the things we know that absolutely sets the table for HCM is high blood pressure or
Mm.
hypertension. And, so as I'll make another PSA here as we move on through our conversation, and that is that every cat parent, listen, it's your responsibility, you guys, to ask your veterinarian to check your cat's blood pressure at least once a year
Mhm.
after about 5 years of age. Because what we're finding, the more we look for high blood pressure in cats, the more we find. And there's nothing more heartbreaking than to have a cat who's visual one night. They're jumping onto and off the furniture, they're chasing the laser, they're chasing the ball, and to wake up the next morning and your cat is permanently blind.
Yeah,
And the most common reason for that is high blood pressure. Veterinarians hate to take it because it's
they
a
do.
pain in the ass, to be honest with you. You're trying to adapt human blood pressure or dog blood pressure machines to cats. Cats are always stressed. Sometimes they're swatting at you, but that's a very high yield test. So please, if you're in it to win it with your cat, please have your veterinarian check your kitty's blood pressure.
That's a great PSA. I think a lot of people, number one, don't know that that's even a thing. that you can have your cat's blood pressure taken and that it's something that your regular vet can and should be doing. Also, this is another question for my own personal edification. So I'm just filling up my
Go
podcast with
ahead.
my
Yeah.
own questions. If you give your cats a pre vet visit anti anxiety medication like a gabapentin or a trazodone or a trazapentin, as I have to give for Kevin, for example, who's really not loving going to the vet, is that going to seriously affect or impact his blood pressure reading?
Yeah, it can. It can
Yeah.
artificially I mean, so cat blood pressure can go either way, can't it? I mean,
Right.
cats get so stressed going into a clinic that a cat with normal blood pressure can look like it's just coming off the charts.
Right.
And the flip side to it is that if you use drugs to settle that down, you may get an artificially low setting. And so one of the things, in all honesty, Christina, that we're starting to do with our longevity clients is I'm starting to send you blood pressure testing equipment at
Mm.
home, and I ask for a couple $100 as a deposit, send it to you for a week. These are simple things that you can do. And most cats are vastly less
Uh,
stressed,
yeah,
vastly more amenable to having you put a blood pressure cuff on their arm than having your veterinarian in strange surroundings after a car ride. So that's one of the things
absolutely.
that we're doing. We're pushing hard to develop. I mean, I have a couple blood pressure machines that are already in circulation for that purpose because you're not the only one to worry about that.
Yeah. No, that's great to hear. I love the idea of, especially for cats, more at home vet visits for when it's appropriate. That's what we used to do when we were still in New York City is we would have the vet come twice a year and just see everybody and just get it all done in one day, but it was so much easier for everyone. Unfortunately, now where we are, that's not a service that anyone offers. So you talked about rapamycin. Can you tell a little bit about what it is and how it's being used in cats?
Yeah, absolutely. So, rapamycin is a medication that was found on Easter Island, and the native name for Easter Island is Rapa Nui. So the Rapa component of rapamycin comes from its origin there. But
Mhm.
originally it was introduced as an immune suppressive molecule in human medicine. So that if Christina, gave you my kidney, you might have to take rapamycin or other immune suppressant drugs to prevent your body from rejecting my kidney.
Okay.
However, along the way, we learned that patients who were on rapamycin lived longer than we expected them to do so. And so that led to increasing studies around in the human ranks about what
Mhm.
happens if you just take rapamycin. And what we found is that in mammal species, every in every mammal species studied to date, rapamycin increases lifespan by up to 14% without any other intervention. And so, that's a pretty amazing statement. And why does that work? Rapamycin acts in three different ways. It acts to reduce cancer incidence. It acts to support heart function, as we've already talked about with HCM, and it acts to reduce inflammation, which helps prevent kidney disease and arthritic pain. And
Mhm.
that's kind of a big three right now. And so if you're asking me why cat parents use it, it's 95% of them, Christina, are using it
Mhm.
in a setting of HCM, but
Right.
5% and growing are using it as a preventive in their younger cats because it is such a safe molecule. We don't see any side effects from it. We really don't.
Mhm.
And so, if you're looking for a good way to help extend your cat's life by reducing cancer incidence and supporting cardiac function and reducing arthritic pain, rapamycin is a great choice for you. A little bit expensive, but the reality is there's no more effective molecule at this point in time to help your cat live our longest life.
Does it have any interactions with anything that your cats might be taking as well?
No, not I mean, in theory, it uses if your kitty is on cyclosporin, if your kitty is
Mhm.
on atenolol, in theory, it is metabolized by the same pathway that these drugs are metabolized through. So that if your metabolic pathway sees more rapamycin, there is the theoretical chance that the cyclosporin or atenolol levels could build up in your kitty's blood higher
Mhm.
than normal. But I would tell you that from a practical perspective, we just haven't seen any problems with it. We see 3 to 4% of cats that develop diarrhea or loose poop on it, but
Mhm.
almost without fail, Christina, within 3 or 4 treatments, because these are just given one tab once a week.
Okay.
Within 3 to 4 weeks, that solves itself without any further therapy.
It's cool. All right. I will have to look into that.
Yeah,
Um,
you should. You should. I mean, it's an interesting it is the best approach right now to help your cat to minimize the arc of HCM in your kitties and also to improve their lifespan. So, listen, 5 years from now, we might be going down a different rabbit hole, to use your phrase, but the
right.
reality and if so, if the science changes, I will change too. But as it stands right now, rapamycin is the single biggest tool in our longevity gun for cats.
That's cool to know. And I mean, the thing about science is that it's always changing, right? But then we just have to
Mhm.
change with it. So
Yeah. Yeah.
that's okay. So I want to pivot and talk a little bit about nutrition because I
Okay.
think nutrition is a very confusing space for cat guardians. I get a lot of requests to talk about it. That is not my space of expertise. But are there any myths that you would like to clear up? How do you think someone could feed for longevity without like getting too crazy about it? Are there good upgrades that people could make? Like, what's your spiel on nutrition?
Funny part is the cats kinda ruin my spiel. Every time I give a spiel, cats ruin it. And so,
Fair.
I'm gonna tell you that in general terms, I think that the fresher the food you and I use, the fewer preservatives, the fewer artificial ingredients, the longer you and I will live, the longer our dogs will live, and the longer our cats will live. Now, the hard part is that you and your dogs are easier to make that sale to than many cats. Many cats are very, they may be food motivated, but they only like one food or they only like one flavor. And that can really become difficult for us because I'm going to tell you that in a perfect world, if I was cooking specifically for my cat, I mean, that'd probably be the best would be to home cook for my cat,
Right.
just, with a little olive oil and some fish or some poultry or whatever the case may be, combination of veggies and fruits. But, cats really aren't built like that. And so I'm gonna tell you that across the board, the things that I would avoid are all the artificial flavorings, everything that
Hmm.
anything that looks like a gravy, I'm not gonna give to my cat.
The stuff
Anything
with
that look
cheese in it.
yeah, right. You took the words right
Yeah.
out of my mouth. Any cheese or cream product, I'm just not gonna give to my if I wanna give them cheese or cream, I'm gonna give it to them I'm gonna cut a little chunk off a cheese wheel, or I'm gonna
Hmm.
give them milk. I'm not gonna rely on some manufacturer's representation of what that should look like. Because as Christina, she made a very astute observation a little while ago, and there are more cat diets are designed to sell pet parents than are designed to be healthy for our cats. And so I know you asked for specific ingredients and the like, and I'm gonna weasel a little bit on you there,
Okay.
but am gonna make this statement. The biggest way, the one way that has been proven to help an individual live longer, whether that individual is a fish or an elephant or a cat or a seal or a dog, is
Hmm.
to reduce their calorie intake. And so many of the patients that I see come in as fat cats that are setting themselves up for arthritic disease, setting themselves up for cancer, for kidney problems, for arthritis. And the easiest way for you to extend your cat's life, and oh, by the way, save 5, 10, 15% of your food budget money, is to
Hmm.
feed them less.
Yeah, I agree, and I think that number one, I think a lot of pet guardians may equate giving treats and food with quality time spent rather than doing other enrichment activities. And so maybe instead of giving those extra treats or that extra food, we could translate that time into let's play for 20 minutes. Let's do like
Absolutely.
run around the house for 20 minutes.
Better for both of
Really
you.
exactly, right? And that could really be the way that you're showing your affection rather than as just dispensing treats. I also want to say that I do think that the math for figuring out the caloric intake that your cat needs can be very daunting for people. I'm usually incredibly anti AI, but I will say that ChatGPT can be good for this use only for
Yeah,
plugging
absolutely.
plugging in because there doesn't seem to be any kind of like doing the math like generator online anywhere for figuring out specifically my cat weighs 15 pounds. I want them to weigh 12 pounds. They eat this food which has this many kcals. This is the, crude protein. Putting in all the bits and saying
Mhm.
my cat is sedentary. My cat is actually very like runs around. You can use AI for that formula, and it will give you a very good breakdown of what you should feed your cat. Again, probably not dry food, but for how much you should feed your cat, and it does it in a way that you're not gonna wanna rip your hair out.
Yeah. Yeah.
So
So, yeah, as we head towards closing here, let me just make a few recommendations, kind of
yes.
give you a boilerplate, kind of a framework that many of your pet parents could use to assess
Mhm.
their cat's lifestyle, their health, and how we could improve it. So, I'm going to start with, just by recirculating, retracing our path back to
Yep.
diet. I mean, in general, less food is better.
Right.
Look to avoid all the artificial ingredient. Anything that was designed to sell you, please avoid it for the sake of your cat. And then when it comes to lifestyle, certainly your kitty, whether they be inside or out, needs exercise. But
Mhm.
we have to look at what their traffic pattern is. You have to understand that cats are typically 12 to 14 inches tall. If they're running up and down the stairs all day long, that's not very similar to you and me doing box jumps at our local gym. I'm 6 foot. That'd be like me jumping 3 or 4 foot on a repeated basis and jumping back down again.
Right.
Repeated stairs can be very difficult for a cat to handle longer term. The same thing about jumping onto and off of furniture. While jumping up is relatively easier for cats, if you have a tile floor, for instance, think about
Mhm.
the impact that they're putting on their little wrists and elbows as they jump down. So, whatever you can do to minimize the jumping and the stairs in your kitty's environment, or at least to pad those areas, will be a benefit in terms of their survival. We haven't really talked yet about dental disease, but I would
Mm.
tell you that one of the very best ways, I mentioned it earlier, probably the single best way for you as a pet parent to extend your cat's lifespan is to set them up for at least yearly anesthetic dentals, not non-anesthetic dentals, anesthetic dentals that will allow your veterinarian to take x-rays of every tooth in their body to diagnose any periodontal disease that's present and treat or extract the tooth if needed.
Mhm.
That's the only way to solve it. But if you're not dealing with periodontal disease through anesthetic dentals, you're setting your cat up for the toothache of all toothaches. And Christina can speak very directly to that with her cat, Kevin's history of stomatitis. But
Yes.
you're also creating a situation where the oral bacteria are going to worsen your cat's heart function. They're
Mhm.
going to worsen your cat's painful joints. They're going to worsen your cat's kidney disease. So the one thing that you and your veterinarian could work more closely at almost across the board is always dental care. Now, here's the deal. I'm going to give you a trade-off here because spend more money on your cat's dental care, but
Mhm.
spend less money day in and day out on their vaccines. Why is this so important? Now, listen, I'm not discounting. Every cat should get rabies, and we can talk more about that if you wish. But the reality is that for the average inside cat, there's a real question as to whether they should be vaccinated against leukemia and the FVRCP, the Decipher complex, on anything resembling a yearly basis. Now, maybe we look at it every second, every third, every fourth year. Why is this? Because I, as a veterinarian, have inadvertently killed at least 7 cats that I know of by vaccinating them through my 40-year career. How did that happen? Cats are notorious for developing skin cancer at the site of
Mhm.
any puncture through their skin. Now, that can certainly be your neighbor's cat, as part of a cat fight, but it can absolutely be the vaccine needle that I just injected your cat with. And if I'm vaccinating your cat against a disease that they are not being exposed to, I question that. Now, the Latin word for that may very well be malpractice. And, taking that to the next step, why does your veterinarian give your cat rabies vaccines way down at the bottom of their right hind foot? And why do they give leukemia vaccines way down at the bottom of their left hind foot? When a schmo like me, 40 years ago, I just scruffed them and gave them a vaccine kind of in between their shoulder blades. Why do we do that? Because if a cat develops skin cancer at the site of that rabies or at the site of that leukemia vaccine, it's easier to amputate the leg
Mhm.
than to deal with the cancer up on the trunk or the thorax.
Right.
So let me rephrase that question. Why would we be considering amputation in a cat for a non-essential vaccine? There's a disconnect in there someplace for me. So, moving right along, because I'm not done yet, Christina, but the
Carry
next thing
on.
I would talk about is just simply diagnostic tests. If you have a male cat, you really ought to be checking his urine a couple times a year because you're worried about their urinary pH, you're worried about the crystals that Christina has spoken about already. In any cat, you ought to be getting blood pressure, boys and girls, because, there's nothing more heartbreaking than waking up with a blind cat, and I've seen that happen time and time again. As your cats age, let's check their Pro-BNP to assess their heart function. Let's check their SDMA to check their kidney function. And, if hypertrophic cardiomyopathy or if your cat's longevity is a player for you, let's talk about prescription longevity drugs. They all have a place. Don't skip straight to prescription longevity drugs. Let's address your cat's diet. Let's address their lifestyle. Let's address the supplements. Let's address the veterinary care, but prescription longevity drugs have a huge role as well.
Great.
Boom. That is longevity science for cats rolled up into one.
Yay. If there was one little change that listeners could make today, what do you think that people should do for their cats?
Stat, I clearly heard you say one. I'm going to give
Mhm.
you three.
Okay.
I'm going to say, let's pay attention to your cat's diet for all the different reasons that we've talked about. I'm going to say, ask your veterinarian why, UHY. When they make a recommendation around a particular food, when they make a recommendation around a particular vaccine, ask them why this applies to my cat, and listen very closely to that answer. Some of them may not be able to answer that for you. It may just be
Mhm.
corporate policy. And then the third part of things is just understand that they make a living by hiding things from you and me. And so there is a role for the dental care. There is a role for diagnostics if you and I want to help our kitties live longer.
All right. Well, thank you so much, Dr. Kevin, for being on the podcast and for all of your insight that I'm sure is going to be very valuable for all of our listeners. And I will be excited to have you back on for part 2, where I can continue to pepper you with annoying questions about cats.
I understand part of that's just self-deprecating, but the reality is I love this. We're all in this together. And so I want to mention one last thing. And you spoke
Mm-hmm.
about my website,
Yes.
www.helpingpetslivelonger.com. But I would also tell you that we are all in this together. And so I have a second website set up for podcast listeners, and it is
Mm-hmm.
www.freevetcall.com. And it's just a one-page website, Christina, that links
Mm-hmm.
directly to my personal calendar. And if your listeners want to hit freevetcall.com, we'll set up a 10 or 15-minute consult. There's no charge for it whatsoever. But, if you have questions about your cat's teeth or their vaccines or, whatever comes down the road, I'll be happy to help you, including advice on the prescription drugs that Christina and I have spoken about today. I love my cats. I love my dog. I know you guys too. Let's work together to keep them around for as long as we can.
I agree. Thank you so much. That is such a lovely resource, and I'm sure that people will take you up on it. And for everyone listening, I will link to both of those websites in the show notes so you can find them easily. And thank you again so much. It was so nice to talk to you.
Christina, I loved our time together. I appreciate everything you're doing for the cats of the world, and I look forward to our next visit.
Likewise. Thanks so much for listening to the show. If you're looking for one-on-one support with behavior issues like litter box problems, aggression, anxiety, or multi-cat dynamics, you can find me through my behavior consulting business, Catitude Adjustment, at catitude-adjustment.com. If you like the episode, please consider leaving a rating or review. It really helps us grow. For more episodes, show notes, and resources, head to hissandtellpodcast.com. Huge thanks to Cat Beats for the music, and I'll see you next time.